Now we're going to go through the short lateral rotators. What we're going to do is bring the patient's limb into the test position here. So again, we're going to be doing a resisted range of motion where I'm trying to push his heel out and he's not going to let me do it. But what's really nice about this is I can find that anterior border or anterior inferior border of the sacrum. I can place my hand on it and then I can find the greater trochanter, and I know that's going to be where the piriformis runs. So I can lay my pinky across that line. And an easy way to remember the short lateral rotators is go P, S, O, I, and Q. And what that means is you have piriformis where my pinky is, and then the ring finger is going to be the superior gemellus, and then you're going to have obturator internus, inferior gemellus, and then the quadratus femoris, which is going to be through this area here. And again, the muscle test and challenge is going to be similar for all of them. So hold there nice and strong. So I'm going to push out, but what I'm going to do is then palpate in. And if you want to isolate like piriformis versus superior gemellus, you can just put a little more in with that finger at quadratus femoris. I can feel it contract right beneath my thumb when I sink in through the glute in each area. Really easy way to check each one of these. We know they're very tightly lying together. And again, we can take his limb all the way out, so just relax for a sec, and we can check various parts of the range of motion. So they're hold there nice and strong. And again, we can check through to see what the short lateral rotators feel like under each one of our fingers. So with the limb in test position here, if we want to get the lateral fibers versus the medial fibers, what we can do is curl our fingers a little bit here. We're still along the lines of all the short lateral rotators, and then we can sink in with a little bit of a muscle test. Hold there nice and strong. Don't let me move it out. Good. And then this will catch the lateral fibers of those muscle groups. And again, you can sink one finger in a little deeper in each spot to check one over the other. If we slide a little medially, now we're getting the medial fibers of that muscle group. Whether it's piriformis, superior gemellus, obturator internus, inferior gemellus, quadratus femoris. This is the easiest way I've found to learn the short lateral rotators. Just remember P, S, O, I, Q. If you can remember that mnemonic, it's going to be really easy going forward when you're trying to remember, man, what are those muscles and where do they go and where do they run? If you just place your hand on the edge of the sacrum, let your fingers lie down, it's already ready to go P, S, O, I, Q. And then, of course, you know how to do the muscle test for all of them in this position here. Really nice way to muscle test and palpate and remember those down the road. This is a really easy way to get clinical application from the basic anatomy you've learned.